Okay, let's talk about something we've all dealt with at some point. Nausea and vomiting, right? It's one of those universal human experiences, and it's just plain awful. But because it's so common, it creates this real tricky situation. We're left asking ourselves a really important question. How in the world do you know if this is just a 24-hour bug, a simple annoyance, or if it's your body sounding a serious alarm bell for a medical emergency? Drawing that line is exactly what we're going to figure out in this explainer. So let's start with the basics.
Our first instinct is usually to blame the last thing we ate. But from a clinical perspective, the first rule is to always take a step back and look at the whole picture before you decide what to do next.
And here's the good news. Most of the time, your gut instinct is probably right. We're talking about the usual suspects here: a stomach bug, a bit of food poisoning, maybe even motion sickness. These things are what doctors call self-limiting, which is just a fancy way of saying they'll usually go away on their own without you having to do much.
But what about those other times, the times when it's not a simple case? This next section is without a doubt the most critical piece of information we're going to cover. These are the red flags that mean it's time to stop guessing and get immediate medical help.
And let me be perfectly clear, what I'm about to list aren't just suggestions. These are medical red flags pulled straight from clinical guidelines. If you hear any of these and think, hey, that's me, the advice is always the same. Go see a healthcare provider. Period.
First off, you have to pay attention to what the vomit itself actually looks like. I know, it's gross, but it's important. Green bile could mean there's a blockage. And if you see anything that looks like coffee grounds, that's a serious sign of digested blood. Both are major red flags. And of course, if you just can't stop vomiting for more than a day or two, your body is screaming for help. Next, I want you to think beyond your stomach. How do you feel overall? A really bad headache, a stiff neck, or feeling confused? Those could signal a problem with your brain or nervous system. Severe pain in your chest or back is another huge warning. And this should go without saying, but any loss of consciousness or feeling incredibly drowsy is an absolute emergency.
All right, now let's zoom out and look at your whole body. Are you seeing signs of serious dehydration, like you haven't had to pee at all, or you're just intensely thirsty? That's a big problem. A high fever points to an infection your body's having trouble fighting. If your belly is tender to the touch or swollen, something could be wrong inside. And this is a big one. Any vomiting that starts after you've hit your head is an automatic trip to the doctor. Don't wait.
And finally, there are a few special situations where you just don't take any chances. If you're pregnant, if you have a condition like diabetes, or if your immune system is compromised, you should always be extra cautious and call a professional. Same goes if you've recently traveled internationally, or if the symptoms popped up after a surgery. In all these cases, it is so much better to be safe than sorry.
Okay, so let's say you've gone through that whole mental checklist and thankfully, no red flags. Whew, what do you do now? Well, this is where we get to put on our detective hats and think like a pharmacist. Here's a super practical checklist you can use to figure things out at home.
It really just boils down to 4 key areas. First, the symptoms. What are they like? How bad are they? How often are they happening? Second, the context. Think back. What did you eat? Have you traveled? Any injuries? Third, your personal history. Any other health issues or medications you're taking? And last, are there any other buddies tagging along, like a fever or diarrhea? Every answer you have is another clue that helps you see the full picture. So, if you've gone through the list and everything is pointing towards a simple, non-urgent case, we can finally shift gears and talk about managing it at home. Let's walk through how to do that safely.
And this right here is the #1 most important rule. Before you even think about any kind of medicine, your only goal is hydration. When you're vomiting, your body loses a ton of fluids, and putting those back is the single most critical step to getting better.
So let's look at the game plan. When you're doing self-care at home, your entire focus is on oral rehydration. That means sipping water or special rehydration drinks. Now, a pharmacist might suggest an antiemetic, which is just a medicine to help stop the vomiting, but they'll usually only do that if it really looks like a simple stomach bug. And, this is key, only after you've started rehydrating. The main takeaway here is simple. Hydration always comes first.
So why do we keep hammering on those red flags? This next part is really going to drive that point home. The reason it's so risky to just diagnose yourself is that the list of things that can cause nausea and vomiting is shockingly long and really varied.
So the most obvious place to look, of course, is your digestive system. This bucket includes everything from that simple stomach bug we talked about to much more serious problems like a blocked bowel or even hepatitis. These are all problems that start right there in your gut.
But here's where things get wild. The problem might not even be in your stomach at all. Your brain has a direct hotline to your gut, and it can be a massive trigger for nausea. This means the real cause could be a migraine, a head injury, or even a super serious infection like meningitis.
And then you have what are called systemic conditions, where the nausea is just one symptom of something affecting your whole body. We're talking about incredibly serious things like diabetic emergencies, liver or kidney failure. Heck, even a heart attack can present with nausea as a key symptom. This is exactly why paying attention to those early red flags is so incredibly critical.
Okay, I know that was a lot of information. So let's boil all of this down into one final, simple rule that you can actually remember and use.
And please remember, even if you start by managing at home, you have to keep monitoring how you feel. You absolutely need to see a doctor if things aren't getting better in a day or two, if you feel worse, if new symptoms pop up, or if you feel better for a little while but then it all comes back.
And all of this, everything we've talked about, brings us to one final, powerful piece of advice. We've seen that nausea and vomiting can be anything from a tiny inconvenience to a sign of a true life or death emergency. And that's why the simplest rule is also the safest one. When in doubt, get it checked out.